I can confirm that following the receipt of health advice this morning from Dr. Chant and following conversations with both the Victorian Premier and the Prime Minister of Australia, Mr Morrison, that New South Wales and Victoria will be shutting down their borders from midnight tomorrow night. So today and tomorrow is the last time in which any Victorians will be allowed across the border unless they have a special permit or some exemption. We have done this based on health advice, and especially given the fact that when our nation had those higher number of cases back in February and March, the vast majority of those cases were from overseas travellers or their direct contacts. What is happening in Victoria is very different, which is why we've had to take this necessary step. We wouldn't have taken this step unless we absolutely had to. And in essence, it also takes pressure off Victorian resources because our police and our health officials are able to do their jobs on this side of the border and allow the Victorian officials, whether it's their health officials or their police, to focus on getting a control of the virus. I appreciate that the Victorian Premier has already spoken to the media today, and he would have outlined the fact the community spread is increasing throughout Melbourne. And we are also concerned, based on the health advice I received this morning, that there's no guarantee that some of people in regional Victoria may have not been seeded, what they call seeding, or we don't have any confirmation that nobody in regional Victoria is immune from the virus at this stage. Please know this isn't a decision we take lightly, but during the pandemic I've always said New South Wales will have a no regrets policy. And I thank both the Prime Minister and Mr Andrews for allowing us to move forward with this decision. And I also stress to the other states, now that New South Wales has taken this decision, and given where we are, there's really no excuse for any other state apart from Victoria to have any border closures with New South Wales. And I urge all the other states of Australia, in our national interest, to think about that. Given this move by the New South Wales Government, we now anticipate that the rest of the nation will be able to deal with each other directly without any hard border closures. I will now ask the Health Minister to say a few words. Dr Chant will then give an update today which confirms again no community transmission in New South Wales, which is pleasing, but we are forever vigilant and forever mindful that what's going through Victoria can very much happen in New South Wales. And I also want to confirm and thank the New South Wales Police Force. Commissioner Fuller and I and relevant authorities have been in contact for a number of days now in anticipation that this could be occurring today. And I want to thank him for being so ready, because as you know, there are around 55 border crossings between New South Wales and Victoria. It's a mammoth task. And the Commissioner will outline the action the police have already undertaken, and also consultation we've had with our federal authorities and the Victorian authorities as well. Minister Hazzard.
Thank you, Premier. Well, obviously for quite some time now we've been struggling to manage the expectation of whether or not the communities in Melbourne and around Melbourne would continue to have transmission. That has been concerning, as the New South Wales Health Minister, as has been said by the Premier. We were concerned that if the transmission rates continued in Victoria, that could have some negative impacts here in New South Wales. We have been considering this now for quite some time, and the conversations have been many as to how we could approach this. Obviously, trying to strike the balance between the health issues here for our residents, but also the economy. This morning at 8:05 a.m, Dr Chant conveyed to the government her team's view, her view, that we now had to take further steps to safeguard New South Wales. We've already taken in the last few days measures to stop any Victorians coming from hotspot areas. Our concern, as the Premier said, is that that seems to be spreading through the city of Melbourne, and we do have concerns that it may in fact spread beyond Melbourne. Obviously we're hoping it won't, but we can't afford that risk here in New South Wales. So the decision has been taken that the borders will shut. Can I say the borders shutting should send a very clear message to all New South Wales residents right now. If you're thinking of going to Victoria in the next 24 or 48 hours, the strong suggestion is do not go. And to Victorians who might be thinking, if you're coming from areas outside the designated hotspots at the moment, our advice to you is don't come, because there will be some requirements around self-isolation. I'll ask Dr. Chant to expand on that. Dr. Chant.
Thank you, Minister. I'll just give you an update on the cases that we've had 10 new cases of COVID diagnosed in New South Wales in the 24 hours to 8 p.m. last night, bringing the total number of cases to 3,240. There were a total of 11,555 tests were notified in the reporting period, and New South Wales has carried out over 950,000 COVID tests. There's currently 69 COVID cases being treated by New South Wales Health and 1 in intensive care, and this person does not require a ventilator. In relation to the current settings, we are advising that anyone returning from a COVID hotspot area is required to self-isolate, and self-isolation really means staying at home, minimising your contact with anyone else, and it doesn't mean going to work, engaging in any other social activities outside the house, and also not permitting people into the house. We think this is a prudent and precautionate approach, but based on the fact that we have seen increasing cases extending outside the hotspot areas, and recognising that there is often a lag between when cases are recognised and diagnosed, we needed to get ahead of the potential spread to safeguard the seeding of New South Wales. My key message to all members of the community is, regardless of where you've been, please keep presenting for testing. Please present with even the mildest symptoms for testing. Early detection and diagnosis of cases in the community is going to be a key for us managing and responding to COVID in the year ahead. Thank you.
Good morning. Thanks, Premier. New South Wales Police is still the combat agency for COVID-19, and in that we've been conducting a lot of operational modelling around potential outcomes, and one of those was the closure of the New South Wales-Victorian border. We know there are 4 primary road crossings, 33 bridges, 2 waterway crossings and multiple smaller roads. So the task is not lost on me in terms of the enormity of the logistics in this operation alone. There are 11 local government areas, 5 police districts that will all have to pull together to make sure this operation is a success. I've been in contact with the Department of Defence this morning, and we will seek a fresh request for defence assistance with the border operation. We will also in time be relying on other emergency services. But the reality is, in the first 72 hours from midnight Tuesday this week, it will be difficult, not impossible, but difficult to make that crossing. There will be delays whilst we work through who are essential workers. We have learnt lessons from Queensland and South Australia. Services New South Wales by tomorrow will have an online application for an exemption. We will take a sensible but pragmatic approach to those coming into New South Wales to ensure that we protect the people of New South Wales. Thank you.
Questions?
You previously labelled border closures crazy, saying that we're all one country and don't understand why any borders have been closed. Do you feel a little bit silly having to do this now?
Not at all. When we made those statements, or I made those statements, the vast majority of cases that New South Wales and other states were experiencing were from overseas travellers or the direct contacts. What is happening now in Victoria is very different. What is happening now in Victoria is the overwhelming majority, I think in fact all of the cases that the Premier Andrews announced today are from community transmission. This is unprecedented in Australia. That's why the decision of the New South Wales Government is unprecedented. We've not seen anything like this. In fact, when New South Wales had the record number of cases a day in March in Australia, again, the vast majority of our cases were either overseas travellers or the direct contacts. Because the Victorian situation is so different, it's actually a new phenomenon in Australia. And that's why, in consultation with the PM and Premier Andrews, New South Wales is taking this decision, which in fact is welcomed by Victoria because it releases resources from Victoria. It allows us to monitor the border. And I just wanted to add one point the Police Commissioner made, is that we've already been in contact with a number of border communities to explain to them that whilst the next 48 hours, next 72 hours will be difficult in terms of not really letting anyone across the border, we appreciate that for communities like Wodonga, for freight going in and out of Eden and other places, there will be permits available, exemptions available, and Service New South Wales will be able to do that online and make it easy as possible for people who live in those communities. But I do want to stress, what is occurring in Victoria has not yet occurred anywhere else in Australia. It's a new part of the pandemic, and as such it requires a new type of response. But again, I say to all the other states around Australia, use this as an opportunity to now take off your borders with New South Wales, because in terms of jobs and economic activity, whilst all of us need to support Victoria during this difficult time, and New South Wales, along with many other states, will continue to provide our support, whether it's through contact tracing, whether it's through doing thousands of daily tests and also having health officials down there. We will support them in every way we can, but we also have an obligation to make sure we don't create any further job losses in the rest of the nation, and we support our economy in the rest of the nation by having free and open borders with the rest of the nation.
When you put the plan to Mr. Andrews and Mr. Morrison, did they argue against it at all?
No, in fact, they both welcomed and understood the New South Wales position. Both were extremely supportive and understanding, and in fact, we are in this together. Even though Victoria is going through this difficult time, I certainly don't want Victorians to feel that they're being singled out in any which way. This could very well be New South Wales at some stage in the future. This is very much a team effort. This decision was taken through consulting the PM and also consulting Minister Andrews in Victoria. But I also do want to stress again that what's occurring in Victoria is a new phenomena in Australia. We don't want it to occur in New South Wales, and therefore we've taken this action. This is the first time where you've had major community transmission not based on overseas travel, as in beyond that point, and that has triggered the New South Wales decision. But having said that, given the record of New South Wales, I do ask all the other states, with the exception of Victoria, to open their borders to New South Wales.
Premier, this is the first weekend.
I'll go there first and then I'll come to you. Yeah.
If it's necessary to do this in 36 hours' time, why do you not believe it's necessary to enforce the border closure immediately? Won't you have a whole stack of people flooding over the border?
Well, just to make 2 points clear, already we have police and health officials on our borders stopping anybody from those hotspots coming to New South Wales. So we've already had that in place for a number of days. The Health Minister will also be ensuring that come midnight tonight, so for the next 24 hours, the hotspots will extend to all of Melbourne. So nobody from Melbourne will be able to cross the border in the next 24 hours. But come midnight tomorrow night, it'll be all Victorians. So obviously we're taking that immediate action. So the Minister for Health will sign a health order saying nobody from Greater Melbourne and its surrounds can come to New South Wales tomorrow, but obviously tomorrow midnight is when all Victorians will be prevented from coming across the border unless they have a permit. And I want to say again, I appreciate the stress it might cause our border communities. I've already been in contact with a number of the local members down in those communities to advise them that we'll be working with police and Service New South Wales to make sure all of their citizens have the opportunity to conduct their regular business in a safe way. The next 72 hours, as the Police Commissioner said, will be difficult. So for some people who normally travel across the border as their daily lives will be restrained until we get the permit system in place. And we hope that'll happen in the next 2 days.
Premier, surely the first week of school holidays, do we have any idea of how many, potentially thousands of people are on their side of the border, on our side of the border? And what do you say to those New South Wales people who went to Victoria, trusting you and your steadfast position that you wouldn't close that border, and now they have to lose those holidays to everyone?
Well, no, we've been very upfront. I think for the last 10 days or even longer, the Health Minister, myself and Dr Chant have advised against travelling to Melbourne. We've already made that very clear. Well, we were very clear about that, and we were very clear to our local residents, and there's always a degree of personal decision making in this, and we are in the middle of a pandemic. And I say all of us, including myself, have had to adjust our travel arrangements a number of times in the last 3 or 4 months. And we've been very clear in the last fortnight, maybe even longer, to recommend people not go to Melbourne. In fact, strongly advise against it, tell them to self-isolate when they return. So whilst I do appreciate it's an inconvenience to a number of people, I don't think today's announcement by the New South Wales Government, especially in view of where Victoria is heading, will create any surprises. And please know that we've been monitoring the Victorian situation daily. The Health Minister, Dr. Chant, and I have been in daily communication with what's going on. And obviously, based on health advice this morning, we've taken this action. But as I said, what's occurring in Victoria hasn't yet happened in Australia. It's a new phenomena, and therefore we needed to take this action. And I ask everybody, please be patient. We know there'll be queues. We know there'll be disruption along our border communities for the next few days, and we apologise in advance for that until we get our systems in place. But I can also confirm, and I want to thank Commissioner Fuller, that he and I have been in discussion about the potential of this occurring for some time, and he is as ready as anyone can be under the circumstances, and I want to thank him for the way in which he's been able to coordinate those troops and coordination with the his federal equivalents in such a short period of time. Yeah, well, obviously there'll always be exemptions. So due to hardship cases, people can apply for permits or exemptions. And so for those reasons, we anticipate there still will be some flights and train services available. There'll also be New South Wales residents returning home. So for that reason, we do anticipate there'll still be flights and obviously passenger train services, but only for those who've got permits and only for those who are returning New South Wales residents. Absolutely. No, they'll absolutely have to self-isolate. We'll be relying on them to self-isolate. But can I stress what Dr. Chant has stressed and what we've been stressing from the beginning of the pandemic, and that is, please make sure if you have the mildest symptoms, no matter what your circumstances, the mildest symptoms mean you have to go and get tested. You may very well have been in contact with someone who may have been in contact with someone from Melbourne some days ago. We know that for some people the virus can be active for a long period of time. So please make sure with the mildest of symptoms that people come forward and get tested. And can I say, I've been so pleased and deeply grateful for the number of people coming forward to get tested. Even on the weekend, we saw nearly 12,000 people get tested overnight, which is good. And we need to keep that testing rate up to make sure. And this is why I really want to congratulate the New South Wales health officials. We've been doing intensive testing since about Australia Day. And so if there have been little bubbles of potential community transmission, we've been able to get on top of it, and that remains important because there is a high likelihood, and there always has been a high likelihood, there are people walking around with the virus in the community, and the only way that we'll be able to contain the spread and stop that spread is when people come and get tested, and our excellent detectives, our contact tracers can get on top of it and make sure they don't continue the spread.
Those exemptions for the essential workers, the exemptions for the essential workers, for those thousands of people that live on one side and work on the other side of the border, are you an essential worker if you have a job in this case?
Well, no, anybody who feels they want to apply for a permit can do so through Service New South Wales. It will be very easy, but you might be someone who just needs to, if you live in Albury-Wodonga, it's one community, and you might have the need for a business reason or a work reason or a health reason. We've never defined essential worker in New South Wales for a reason, because you can never determine someone's exceptional circumstances. So anyone who feels that they will be impacted too much by this border closure, and I suspect many people in Wodonga will, many people in Albury will, many people on a number of places of the crossing, they're able to go to Service New South Wales, get a permit, and then with that one bit of paper they'll have safe access during the course of the closure. But can I also please ask those communities for patience? It will take us 2 to 3 days to get the systems in place. Over the next 2 or 3 days it will be very difficult for our border communities. We just want everyone to be safe and to stay home until we get that system up and running. Service New South Wales anticipates that might be available from tomorrow. We've already actually put them on notice from yesterday to start putting that in place. And we anticipate that will be up and running as soon as possible. Once you have a permit because you're on a border community or someone who might be taking timber to and from the Port of Eden, you will be able to maintain that permit for the duration so long as you don't present with symptoms. And obviously no matter who you are, no matter which side of the border you're on, if you have symptoms you have to come forward and get tested.
How long will this border closure work in
Albury, for instance, and at lunchtime you just want to go over to Wodonga for a sandwich, you can't
No,
do that?
unfortunately, for the next few days at least, you cannot do that. But if you feel that there's a reason why you need to be able to, you're able to apply for the permit. And once you have that permit, you will be able to move between the border communities.
Premier, how long will the border closure be in place, at least at a minimum? And will police and ADF members be at every one of those 55 crossings 24 hours a day?
Look,
to police it?
we're hoping this is just a temporary move. It will really come down to the health situation and the health advice. In New South Wales, we always have a keen eye on the jobs and the economy, but what has motivated us primarily is the health advice, because if you're not in control of the virus, you're not in control of the economy or the prospect of your people being employed and having a normal life. And so that will depend on the health advice, as has today's decision. So we will continue to manage the daily briefings we have. We'll continue to monitor the situation on a daily basis. I don't want to see this happen for a long time. I want to see this happen in short as time as possible. But that's why all of us, every other state and territory, is providing our support and assistance to Victoria. It's in our national interest and in our state's interests to have the Victorian government contain the virus. And so I hope it won't be for a long time, but I don't want to put a time frame on it. It will be based on health advice. I'm not going to put a time on it. It's really based on health advice, and I hope to see, the numbers today are concerning because it shows the replication factor, or the R factor, is increasing in terms of how many people with the virus are passing it on to others. And until that comes down, I don't anticipate the border closure will change, but I will ask Commissioner Fuller to address the second part of the question on all the specific border crossings.
Yeah, thanks, Premier. From a New South Wales Police perspective, we'll be using a whole range of resources across the border. Now, clearly, it's a very long border. Someone could choose to swim across the river, walk through the bush. There are dirt tracks. We'll be using drones and other aerial surveillance at the same time. We'll be focusing, no doubt, on the four primary arterial roads, because we know that's where most of the vehicle traffic comes from. But nevertheless, there will be police, defence and other emergency service workers across a majority of those crossings, and there will be aerial and other surveillance 24/7 right across that border. Look, at this stage we know that there's still an $11,000 fine and up to 6 months in jail. I've reached out to the Health Minister this morning looking for another infringement for those who come from COVID high-risk areas in Victoria into New South Wales. We're seeking health orders for powers to turn people around. So there's certainly strong powers in place, but we will be seeking some additional powers around on-the-spot fines, particularly for those who mislead New South Wales in their exemption application.
What are the powers that you will use to turn people around? Are they a health order power that doesn't exist?
They would be new powers under the Health Act, yes.
Just on the requirement to self-isolate, at the moment, anyone from New South Wales who's returning from Victoria who's in a hotspot, they have to self-isolate currently for 14 days. Will that requirement now extend, once the closure is in force, to New South Wales residents returning from all parts of Victoria?
Look, yes, it will. And if you cast your minds back to when the COVID-19 operation started, before the international lockdowns, we were relying on the same methodology, where people returning from overseas were isolating for 14 days. Police were conducting patrols and enforcing that, and we will continue to do that. We really want people to take this seriously. We have been giving warnings to the public around not going to Victoria, and at the end of the day, if you come back, you really need to be mindful of any symptoms that are flu-like. Get yourself tested, but not underestimate that the pain that all Victorians are going through, and we don't want to put New South Wales through that.
Premier, can I just ask on another matter? The Powerhouse Museum, you announced on Saturday that you're no longer going to close and sell the Ultimo site. Why have you done that? And do you commit to building at Parramatta what you've promised in terms of size, scale and cost?
Yeah, can I say that this decision wasn't taken lightly, and it will cost us extra every year to keep the Powerhouse at Ultimo going. But this is done in the best interests of the arts community. At this stage, we don't want to see further job losses in that sector. We don't want to really thwart that industry in any way. And can I stress to the people of Parramatta, they will have an iconic cultural institution, the likes of which has not been seen. The Science and Technology Powerhouse at Parramatta will be outstanding, and it will be the fourth, but also the signature Powerhouse Museum in New South Wales.
What's the gain, Premier?
What's the gain?
The gain.
Isn't it just that you've been bullied by the CFMEU and other unions that didn't want to knock down
the gain is that we increase the floor space of having arts exhibited in New South Wales. And can I stress that anything we can do to inspire the study of science and maths in the digital age is of enormous benefit to our citizens. As you'd know, between 70 and 80% of what the Powerhouse has is always actually back of house because there's not sufficient exhibition space, so this allows us obviously to have that extra exhibition space.
Are you now dealing with unhappy property developers who wanted to get their hands on the Ultimo site?
I wouldn't know about that.
Premier, on Friday,
I'm always dealing with unhappy property developers.
On Friday, the Police Commissioner said he stood by his decision to fine Don Harwin. At the time, you said you backed police. Why don't you continue to back police?
Well, no, all of us have an obligation to follow the decision of the courts, and that's certainly what I've done, that's certainly what the Police Commissioner has done, and that's what will continue to happen into the future.
So you're not disappointed with Don Harwin anymore? You're satisfied?
Well,
you said
that was a matter dealt with by the courts, and I've got nothing further to say.
Premier, it wasn't just about doing the right thing, but being seen to do the right thing when it was revealed that Don Harwin had done this. What's changed?
Well, look, he'd always argued that he'd not done anything wrong, and he chose to pursue that matter, and the courts decided in his favour, and that's the end of the matter.
Can you explain why you stand by your decision to fine Mr. Harwin?
Look, I think all the efforts of police in enforcing the health orders since this started was about protecting the people of New South Wales, and I've been passionate about upholding some 1,300 tickets. And again, compared to other states and territories, that's quite low. So we haven't been over the top. And I felt it was the right decision at the time. But we have plenty of matters to go to the court that I'm disappointed with the outcome. It's something not new for us. And we just move on and continue to apply the laws in the interest of the people of New South Wales.
Is there a fear about it, people now rushing to the courts to contest those fines, or is it too late for them?
I'd say for many it's too late. They normally have around a 30-day period to contest those, and there is no fear. They're new laws and people have the right to contest them, and I welcome them doing that. But at the end of the day, I'd say to you, I think New South Wales Police has done a pretty reasonable job enforcing difficult health orders.
Commissioner, are you concerned about it?
Healthcare in terms of the share.
Sorry, I didn't get the question, sorry.
Two more things about the border closure. So healthcare with Albury-Wodonga health system. Women in Albury need to give birth in Wodonga or might have surgeries booked elsewhere. Secondly, schools, if it lasts more than 2 weeks, the plan there.
Obviously, we've already discussed this issue, and of course, if you need critical healthcare, you will not be penalised for that at all. We've already discussed that issue with authorities, and Dr. Chant's already provided her advice about people needing critical care will obviously get that. And in relation to schools, well, clearly, if your child goes to a school across the border, that is fine as well. But we do say in every other circumstance, the next few days will be difficult. We're asking people who may normally cross the border frequently in a day not to do so until they've downloaded that permit, to make sure that they have that legal access across the borders. And again, I appeal to everybody for their patience, because we know the next 2 to 3 days are going to be extremely difficult for those border communities. We anticipate there'll be long queues. We anticipate the police will have their work cut out for them in managing the situation. I'm deeply grateful in advance for everybody's patience. We're doing this to keep people safe. We're doing this because it's the right thing to do by our citizens, but we do appreciate that the impact will be more heavily felt by all of our border communities, and that's why we've already been in touch with the local authorities this morning to make sure that we make the transition as smoothly as possible.
Words and actions ahead of the Eden-Monaro by-election hurt the Liberal Party's chances of winning that seat?
Oh, look, I'm not going to comment on that. That's a matter for others to comment on. As you see, we have our hands full in New South Wales and dealing with matters that affect our community, and that remains my focus.
Are you surprised your deputy preference Labor ahead of the Liberals?
Oh, look, they're matters for him, and I think he's already made comments on the record about that.
Should he also say that about a fellow cabinet minister that it's a dog act in relation to boundary redistributions?
As you know, I never comment on what others say. I comment on the job of my team in keeping our community safe, and that certainly remains our focus.
Premier, truck owner drivers are calling for toll relief today. Is there any chance that they may see toll relief, considering they're paying so much more than people who drive cars?
No, we know that nobody likes to pay tolls, especially those carrying freight. But also, please know that all of our taxpayers contribute to maintaining the road services, which are adversely impacted by those heavy loads, and that's why we think that's a fair way to treat the system.
Opal prices also changed today, Premier. Some people are unhappy. They used to travel in the peak period. It's now they're travelling in the peak. They're paying more. What do you say to them?
Well, look, our incentive is to broaden the peak. I mean, ultimately, we'd like to see travel times reduce across the board. And we also know that people coming longer distances do need those discounts, and that's what the new Opal fares really stress. It's really balancing out the peak, but also making sure that those people travelling those longer distances get those discounts.
Do you agree with your Health Minister that everything should be on the table when it comes to potentially charging returning travellers?
Look, it's been no secret that we've been considering that for quite a few weeks already, so that's already the case. Great, thank you everybody.